Sciatica. So let's talk a bit about sciatica, or what is commonly referred to as a pinched nerve in the lower back. Okay. Now I'm just going to draw a rough sketch here of the lower back, the bones of the lower back. Okay. So these are the spinal bones here. And this is the sacrum. Okay. So, and here are the discs. Okay. And the spinal cord runs in here in the spinal canal. And what happens is the nerves that now have to supply the limbs, they exit to supply the limbs. Okay. Okay. Now the sciatic nerve is actually composed of the very last 5 nerves in the lower back. Yeah. 1, 2, 3, 4, 5. Right. So all of these 5 nerve roots, they bundle up together and they form the thick sciatic nerve. Okay. So if there is a pinching at any one of these nerve roots, you're likely to get the sciatica type of symptoms. Now, in sciatica, what happens is you may get a pain in the lower back, but now that pain runs down from the lower back into the buttocks, behind the legs, into the calf muscle, all the way into the ankle or in the foot. Now, the degree of pinching is going to dictate how far down this pain or the symptoms radiate. Okay, so you may have a sciatica type pain that may just stop in the hamstring and doesn't extend below the knee. But if for some reason the pinching becomes more severe, let's say you slip and fall, or something happens, or you lift something heavy and you worsen the bulging of the disc, and then you begin to pinch the nerve at an even greater degree, what you may have is now the pain is now going to extend from above the knee all the way into the calf. And if it gets worse, you can run all the way down to the ankle and into the foot. Now, in the sciatica type of pain, yes, you have the back pain, but also on the limbs, you can get some tingling and some numbness. And when the pinching gets very severe, what happens is that you get limb weakness. Okay. Also, too, the section of the leg or the lower limb where you get the symptoms, whether it's at the back, the side, or the front, is also determined by which one of the nerve roots gets pinched. So if it's the very last nerve root that gets pinched, you're more or less going to feel it down the back. As you move higher and higher and higher and higher, what happens is the pain is going to move in this direction. So let's just say this nerve root was pinched, the tingling and numbness would actually come down the front of the leg. Okay, the lower ones here, let's say these were pinched instead. You get it more on the side. But the most common one that we see here is people reporting the tingling and numbness going down the back. So in these cases here, is the lower nerve roots here that get pinched. Okay. Now, I just want to speak a bit about Piriformis Syndrome, which can manifest as a sciatica type pain. This is sometimes referred to as false sciatica, but nonetheless, it is the sciatic nerve that is being affected. So, what exactly is Piriformis Syndrome? So let's come back again. Let's say this is the sacrum here. That's your tailbone. There's the pelvis. There's your hip bone here. Now, there's a muscle in the buttocks region called the piriformis muscle, a small muscle. Okay, and what happens is the sciatic nerve passes behind the piriformis muscle. In some cases, the sciatic nerve can actually pass through the piriformis muscle. Okay, but what happens here in Piriformis Syndrome, this muscle goes into spasm and is very tight. And what happens? It now begins to impinge on the sciatic nerve. So the sciatic nerve is now irritated, and then you get the same sort of a tingling and numbness that can track down the back of the leg. Now, what you need to understand here is in Piriformis Syndrome, the insult is at the piriformis muscle, not at the disc level or the spinal level. Okay. Now, in certain cases, you can have a combination of both. What you may have is actually a pinching of a nerve root due to a bulging disc here, as well as the piriformis muscle going into spasm. Okay. But in a pure Piriformis Syndrome, there is no pinching at the spinal level, rather the pinching takes place at the piriformis muscle. And to deal with this type of pain, the tension needs to be taken out of the piriformis muscle so that it will ease off the sciatic nerve and stop irritating the sciatic nerve. Okay. Okay, so additionally, a person may not have sciatica or piriformis syndrome, but rather may have some muscle imbalance and spasms that may have the person reporting pain in the back, but also pain in the buttocks, in the hamstring, and in the calves. So let's say the person has, let's say, a spinal imbalance, like say scoliosis. And due to this spinal imbalance, they're putting more weight on one side. Okay, so if you're putting more weight on one side and you're overworking one side of the body, what may happen is that you may get back muscle spasms, spasms in the buttocks muscle, hamstring, and the calves. So the person, may just do some reading and they might think, okay, well, I have sciatica because I have a back pain and I'm also feeling pain down the back of the leg into the calves. That may not necessarily be so. What may be going on is that the person has a scoliosis, and because of that imbalance, they're just overworking one side. And what happens is that the muscles in the back, the buttocks, and the hamstring just get tight. They go into spasm, and has nothing to do with the sciatic nerve. So you can have a few conditions that manifest in the same way, but of course, when you backtrack, you realize that you have to do the diagnosis and realize what is the actual cause of the problem. Okay, so again, this want you to know, not every time you get a back pain that goes on the leg, it's a pinched nerve or a sciatica or a herniated disc. What are some of the treatments available for sciatica? Well, initially a person can start with some medication, anti-inflammatories and muscle relaxants. Okay, now I just want to talk here a bit about the role of the muscle relaxants, and then we'll talk about the anti-inflammatories. Now, in the case of sciatica, if you have a pinched nerve, what you may also get as part of the picture is that the back muscles may go into spasm. In previous videos, we mentioned that there's a natural curvature to the spine in the lower back. Okay, so let's just say facing this way, and the curve is like this. The spine is all at the natural layout of the spine. Okay. Now, what happens is when you have muscular spasms in the back, you lose the curve in the back, and it's all straight or gets straighter. Okay. Right, so you move from curve to straight, and this is something that you would see on an MRI or an X-ray or a CT scan. Now, what happens is, imagine these are your spinal bones here, all stacked up upon each other, and you have your discs here, and the spinal bones are all stacked like this. And on the side here, you got your muscles. So what happens is, imagine you have a disc bulging, and there's now it's pressing on a nerve, and you have some tight muscles on the side. Now, the tighter those muscles are, and they're going to really begin to compress those spinal bones, and what's going to happen is going to worsen the herniation. So by relaxing the muscle, you take some of that compressive force of the disc, so the bones tend to sort of ease off, and that allows the disc to ease off the nerve. Okay, so that's why muscle relaxants can play a role in easing the symptoms of sciatica. With the anti-inflammatories, remember, if you have a disc that is bulging, and this disc is now compressing on a nerve, that compression triggers an inflammatory reaction. Okay, and what happens is that inflammation there, it causes the brain to interpret that as pain. Now, if you reduce the inflammation, the person is more comfortable. Okay, and what happens is, remember, our chronic inflammation is damaging the tissue. So by removing the inflammation or reducing the inflammation, the person is more comfortable. What can happen is that you can help limit or reduce damage to the nerve. In terms of nerve damage, vitamin B complex, okay, is helpful in the repair of the nerve and in limiting the damage to the nerve while you are in the process of treating sciatica. You can get the vitamin B complex via injection or orally. In terms of therapy now, again, the massage now plays a role in reducing the muscle tension in the muscle. So massage and muscle relaxants, they aim to do the same thing, just through different means. But massage is useful. It does help to relax the muscle, and again, to help to reduce any of that compressive force that may be worsening a herniation, that may then be irritating the nerve. Stretches and exercises. So once again, stretches and exercises again can help to reduce the tension in the muscle. So what may happen is you come in and get some massage therapy, help to reduce the tension in the muscle, and right after the massage session now, because the muscles are a bit more loose, it is easier for a person to do their stretches and exercises within the session, as opposed to if you just came into the session cold and you just attempted to do stretches and exercises. It may not be as effective as doing some massage first, loosening the muscles and making it easier for the person to do their stretches and exercises. Now, this takes place in the clinic, but when you leave a clinic session, you still have to do some work at home, okay? So, to keep the muscles a bit more supple, they help to reduce the tension in the muscle. Heat is helpful, okay? So what a person may want to do is they want to put some gentle heat on the back before they do their home routine. Because in the clinic, the therapist is going to guide the person and show the person the type of exercises that they should be doing. So now when you go home next day, some heat can help to reduce the tension in the muscle, warm the muscles up. So now when you're doing your home exercises, it's easier for you to do, and that makes it more effective. Back bracing. Okay, so how a back brace works is that it takes some of the workload of the back muscles, okay? So what happens is now if you put on a back belt, the muscles of the back don't have to work as hard, and that gives them a chance to relax. If you're overworking your back muscles, it's going to be a bit harder for them to come out of spasm. So in some cases, people can benefit from some back bracing. So that takes the tension of the back muscle, because some of the weight of the torso now is transferred onto the back belt or the back brace. Now the abdominal muscles and the back muscles don't have to work as hard, and that can help the person to recover a bit faster. If all else fails and it's a very severe sciatica with a very severe disc bulge that just is not easing off the nerves no matter what it is you do, in that case surgery may become inevitable. Okay, so but before jumping into surgery, your person should at least try some of the conservative measures at first. Okay, so I'm just going to demonstrate some exercises that you can do at home for sciatica. Okay, so now I'm just going to show you some starter exercises here to treat sciatica. I'm going to keep this simple because not every exercise is for everybody. Okay, and I don't want people to hurt themselves doing an exercise that is not indicated in their particular case. Okay, now I'm going to start with a back and leg massage. Remember I spoke about the muscle tension. Okay, so we need to release the muscular tension. So let's just say I was having sciatica down my right side. A good idea here would be to use a tennis ball. So I'm going to lie down on the tennis ball, and I'm going to roll my body so the tennis ball takes tension out of the lower back and keeping it off the spine. Okay, I'm not putting it in the dead center. Keeping it on the side where the muscle is, when you can feel that meaty muscle right here. There's a joint right here, the sacroiliac joint. It's a little sink into the back. I will not put the tennis ball there. I will keep it away from that area. Okay, in the butt too as well, you can massage the butt, hamstring, and the calf muscle. So what I'm going to do, I'm going to start back lying down. So I'm going to roll to the side, put the tennis ball on the lower back right here, lay back down on it, take this leg, put it here, lift with this leg, just roll back and forward. Roll backward and forward. Okay, use the tennis ball to really massage the lower back. About a minute or so. Shift it a little lower down to target the lower part of that section. Back and forth, back and forth. That's really loosening up that area. Okay, remember I'm not putting it here, by the bone here. Put it on the buttocks here. Again, cross the leg, roll to the side. So what this can do, it will target the glutes muscles, as well as so you can take some of the tension off the piriformis muscle. Shift the body. When you're done, look at the hamstring. Swing you here. Now, where the hamstring and the buttocks meet here, just crease here, do not put the ball there. Okay, lower. Because you can start on the hamstring. Use the tennis ball. Get the width of the hamstring. You may find some tight spots inside here that you can focus on and really take the tension out. Bring it a bit lower down. Don't let the ball go into the crook of the knee. Okay? So from here, just to below the crease right here. Then really taking the tension out of the hamstring, because when that sciatic nerve gets pinched, you can get spasms in your hamstring as well as the calf muscle. So you're trying to really loosen up all of those muscles as well to give you additional comfort and to reduce the symptoms that are tracking down the leg. Okay. Calf muscle again, keep it away from the crook of the knee. Start about there. Back and forward. Keep this foot loose. Don't pull this foot back like that. If you do this, you're going to tighten up your calf muscle and the ball is not going to get in there. Alright. Loosen that up. Loosen that up. Bring it a bit lower down. Again, loosen it up. Okay. Now, alternatively, you can use a roller for the leg, well, from the buttocks all the way down to the leg. If you have one of this, is great. Again, put it here, like this. Roll, let it massage the glutes. Same rules apply with the roller. Don't let it get into the crease or into the crook of your knee. Just keep it on the hamstring. All right, put it to one side. Keep the foot loose. Really let that massage the hamstring out for you. And when you're done, same thing with the calf muscle. Do the upper part. Do the lower part. Okay? So depending on what's comfortable for you, you can do that. You can still do the lower back with this, but you will have to offset it. Okay, don't put it dead center like this, because these knobs are going to rub into the spine. Okay, it can be quite uncomfortable. Okay, now we're going to do some stretching of the glutes and the hamstrings. So to stretch the glutes here, lay down in the back, both legs up like this. If you want to stretch this side, cross the leg here, then grab here, pull, and just feel a bit of a stretch right here. And pull. Okay, there is no bouncing. Don't do any bouncing movements like this. Just pull and hold. Come down. What you can do, you hold that for about a minute. Alternatively, you can, if you have some mobility issues, you can grab your knee here and pull it like this. Okay, you should feel a bit of a stretch there, or you can do a combo like this. Okay, it all depends on what your capabilities are and what your pain levels are. Easy, down. Right. Now to stretch the hamstring, you can get a belt, a bed sheet, or if you have a strap like this that's made for stretching, loop it, grab, gently pull until you get a bit of a hamstring stretch. Okay, no bouncing like that. Try to keep your knee straight. Don't do this. Okay, keep your knee straight. Right, gentle tension. Hold for about a minute and gently ease yourself down. Okay, so I was going to show you a very simple piriformis exercise. Let's say in the case you had Piriformis Syndrome, this would be one of the exercises that you may be instructed to do. So to target the piriformis muscle on the right side, how we're going to do it, lay down on the belly. This. Make a figure four, like this here. Keep the foot in the knee here. See where this foot is? And then what I'm going to do, I'm going to lift this knee off the floor while keeping the foot planted in the knee joint. So I'm doing this. See? And what I'm not doing is this. See? I'm leaving the foot planted by the knee. And you will begin to feel that tension right here. It's a great way to help to activate that piriformis and to start to loosen it up. Now, if you're doing this exercise and you find the area feels cramped or stiff, you can quickly follow up by doing a massage on the glutes. So you just flip around, put the ball where you're feeling that tension, put the foot back up there, and you just massage the area out. And then you go back on your tummy and you repeat the piriformis exercise. Okay, another one we can do something we can do for the lower back is the bridge exercise. Okay, If you feel any sort of discomfort or you're not sure about it while you're doing it, you should stop it. But I'll just demonstrate. So the bridge exercise activates the hamstrings, the glutes, and the lower back. In this position here, hands on the tummy, and then you lift the buttocks off the bed, off the mat, and you hold, and you come down. There's no swinging or quick movements. Remember, you're trying to rehabilitate possibly injured body part, and quick, swift movements can injure you. So you don't flip up and drop back down like that. Okay, up and down, up and down. Okay, do it for about 10 to 15 repetitions. Rest about a minute or two in between, and do it again. If you cannot manage 10 to 15 repetitions, do what you can do, and eventually you're going to work up to that point. Now, I'm also going to show you a back mobility exercise. That's the second to last exercise there. So with the back mobility exercise, lying on your back like this, and what you want to do, you want to push your lower back into the mat. So to sort of gauge yourself, you just put your hand here initially, and what you're doing, you're taking your lower back and you're flattening it against the mat, trying to press your hand into the mat. So you're doing this, back. Try to squeeze, okay? Squeeze that hand onto the mat using the lower back. And when you're feeling comfortable, you can move the hand, and you're doing that, lower back. Again, if you're unsure, or you think that your pain levels are increasing, or it just doesn't feel right, you should stop. Now I'm going to talk about the cobra stretch. This is something that you normally see on YouTube videos, and it does have value, but it's not for everybody. So that's why I put the asterisk there. Some people, when doing the cobra stretch, can actually worsen their disc bulging. Okay, I'm going to demonstrate it, but let your therapist guide you. Okay, again, this is not for everybody, but see here. Okay, you're here now, taking both hands beside, gently push up, go towards the ceiling. Feel a bit of a stretch in the abdominal muscles. Okay, for about 30 seconds, and you come back down. Take a break. If you're doing this and you begin to feel worsening symptoms tracking on the back of the leg, you need to stop. That tells us that this movement is now worsening your disc herniation and is further compressing on the nerve. So this may not be for you, but again, I'm just demonstrating this for informational purposes. Okay, so I hope you learned something from that talk on sciatica. Remember, if you're unsure about something, seek professional help. There's no harm in trying to self-treat, but again, if you're not sure or you think things are worsening, definitely seek medical attention, seek the professional help, and get it done properly. Okay.